Longevity Plus would like to thank you for joining our webinar today. Dr. Gordon is an expert on nutrition, mineral metabolism, and anti-aging. Dr. Gordon is a consultant to Longevity Plus, where he is responsible for designing effective, natural supplements that help to support optimal health. Today, Dr. Gordon's talk is entitled Putting the Physics Back in Physician. He will also be joined by co-host Greg Westfall of Renua Medical. So without further ado, please join me in welcoming Dr. Gary Gordon.
Welcome, everyone. I've really been looking forward to today's opportunity to introduce you to Greg Westfall. I've known Greg for many years, and this gentleman is one passionate gentleman about medical devices. And that takes us into a whole new area of healing because, as you know, I have spent a lot of my time teaching people about the biochemistry of what we would call integrative medicine. And to make it easy for you, I'm giving you a slide that tells you that Public Health Alert is an excellent newspaper that goes to everybody fighting chronic illness. And they have spent 60 hours going over my website, GordonResearch.com, to save you time because it takes 8 hours on my website to study food, infection, genetics, heavy metals, hormones, toxins, and they have put it into an incredible, concise, detailed 16-page document that can move you into ultimate wellness and allows you to move then into what today is going to teach you, and that's going to be how, once you've done everything you can with detoxification and nutrition and learned your homeopathy and your support of all the nutrients, what do you need to know about light and heat and oxygen, electricity, magnetics? So Dr. Sinatra's website, and I really respect and love Dr. Sinatra, who's one of the leading metabolic cardiologists, who, along with myself, cancels heart transplants on people using the approach that I call my Fight for Your Health program. So I'm not the only one that tells you you don't need to have that surgeon, but you need to know that he and I both want things to move faster than we can do with just getting the toxins out and the nutrients back in and adding the exercise and positive thinking and the hormones. So we're looking at electroceuticals, but always these only are going to work optimally when it's based on adding what I call my Fight program. So he has pointed out in his new book, Earthing, that sometimes simple things lose us. Who would believe that walking in bare feet in the wet grass could change people's health? Yet it is clearly developing that we are now beginning to appreciate electrons. And as we go into my presentation here to help introduce the important knowledge that Greg Westfall is going to bring to today's presentation, I just want to set the stage and have you understand that no one seems to put together the total picture of why it's so hard today to be enjoying ultimate wellness. And one is this simple slide tells you there's been a collapse of the Earth's magnetic field. Now that's pretty strong, and that really means to us that you're not going to have the vital transmission of energy as our body metabolism is entirely dependent on magnetic fields. Now, I covered this in a talk 3 weeks ago, and I hope at some time just to really refresh your memory about PEMF so you can see that as Dr. Sinatra and I move more into bringing the physics back, some of us will have to have a hyperbaric chamber, and many of us are going to have a far infrared sauna, and we're always going to be looking for what is the ultimate way to help our bodies more efficiently fight against a very stressful and poisoned planet that we live on. So now that we know that magnetic clues are what can allow the whale to find his way and the birds to find their way, and there's some disquieting factor now that NASA tells you that the Earth's magnetic field is collapsing, it's clear that that's pretty shocking because that magnetic field is why we're a living planet and Mars is a dead planet. Once you lose the magnetic energy, the planet would be dead, because you cannot raise your arm off the floor if we let the level of magnetic energy go too low. And it was, we believe, at the time of dinosaurs, 230 million years ago, it was more like about 30 Gauss, and today you're down to 0.3 Gauss. And to make you aware then that this then moves you into another element of magnetism and electricity, because you can't have electricity without getting a magnetic field, and vice versa. Magnetic fields always induce an electric current. So we've been seeing proof then of these changes, which cause some people to sit there and say, wow, I wonder if the North Pole is going to become the South Pole. And now we see birds dropping out of the sky, supporting the fact that there are major Earth changes, and many people will have different explanations, but just a simple one to remind you that in Tampa, they had to renumber the runways because the North Pole has moved so much that what might have been the runway 26 now has to be 261 or 262. So it's important to know that this is all part of health. And even though we can master homeopathy and nutrition and those things, if you happen to be in an area which you now are living in, which is so low in magnetic energy, you might need to have access to a PEMF treatment that I discussed 3 weeks ago on my webinar. And to make you more aware of what's really happening with our troubled planet, this is a free, incredible film taking 1 hour of incredible views from a bird's eye view. And I cannot urge you too strong to see it, enjoy it, and share it with your family. Why do we need magnetism? Every organism on Earth needs and receives magnetic signals, and they are easily distorted by many things that we, with our industrial age, have introduced. And as you weaken the geomagnetic field, it affects the immune system of rats, and it winds up with things like delayed ability to synthesize oxygen or even to release nitric oxygen. The NO are key signaling factors that of influence your and my circulation. So it'll be very believable today when you learn in the presentation today from Greg about the ability to cancel amputations of legs when we learn how to use the right kind of Tesla-based alternating current, low amperage, high voltage electromuscle stimulation, because we all need to think that when your friend suddenly gets so sick that he stops golf or she stops playing tennis, you're on your way to the end, folks, because if we can't use all parts of our body, we age rapidly. So it's important for you to know that all the tricks that I'd outline in my fight program, which are life-saving, and believe me, I am confident when I tell you that my fight program, slide number 2, if you choose to read that 18 pages, gives you more answers than you're getting from any doctor visit to any major medical facility in our country, because I cross many disciplines. I teach why we have to get the lead out, and where the things like the phthalates from our plastic bottles and the polybrominated diphenyl ether, I try to bring the whole story together so you can understand why I'm so excited that I'm sitting here with a brand new back. After 20 years, I'm standing pain-free, able to stand straight, and no one has done more. I've done every massage, I do every exercise, I do sun, I've done everything, but PEMF brought me back to life, and I know, since these units are not cheap, that I won't get them in every doctor's office. I've had a few wealthy patients buy them for themselves because I'm admittedly addicted. I'm spending 10 minutes a day, or even 20 minutes a day, because it's so exciting, because it's turning on in my body, it's turning on stem cells, and when you combine that with my nutrients, you have an answer to treat all the people on the planet that are so depressed. And depression is one of the biggest things adversely affecting our health today. And now that you begin to put all these things together, you'll see that ATP is the currency in your cells of energy. This is the absolute energy that it takes for a cell to reproduce itself, to do its job that's doing, if it's a heart, if it's beating, and to pump out toxins. And no one can spend any of the time on my 8 hours of webinars where I teach you where the heavy metals came from and what toxins are in every baby when they're born, and why if you have a loved one who's pregnant, you better see and go to my slides and learn how you can reduce the chance that that offspring of anyone who's pregnant on the planet today in America, it's 1 out of 4 of their children will be living on a drug for the diabetes or the learning disorder or the cancer or the other long list of illnesses that we're seeing in children today. And it's a complicated thing to live on a planet that's going through major changes. But I am able to give you answers, and they do come together, and I'm very excited to point out to you that we alleviate depression by making new stem cells and, in fact, rewiring the brain. Now, you can't do that without appreciating the physics involved. Cells have to communicate with the cell next to them. So, yes, I will have everybody who will listen to me take Beyond B12 and take that methylcobalamin and take it sublingually every day with the methyl form of folic acid. And I would have everybody take equal calcium and magnesium that's in the Beyond Chelation Improved or even in the Beyond any multiple. And I want everyone to know I wrote the book about the omega-3 miracle. We need these oils. And I know that you need to be out in the sun in spite of everybody brainwashing you that it's so bad that it's going to give you cancer, which is pure nonsense. Is 100% the benefit of the sun exceeds by a factor of 1,000 the remote risk of a small skin cancer, which I will teach you are entirely able to be treated at home with simple things like we would call it the eggplant cure if you buy that book. So I have to teach people that exercise is still what I do each day because it turns on brain-derived growth factors. So there's a reason that I'm passionate about all this, because I feel fantastic today, and I would really like to have every one of you feel as good as I do at age 76, having proven that I can be tremendously ill for 30 years, unable to participate in sports, have every kind of health problem, including my disabling angina, have inability to go up a flight of steps at age 30, close my medical practice because I'm so sick, and at age 76 be planning vigorously what I'm going to do with the next 25 years, because certainly our inherent potential is for us to be fully active at 100. Now, I showed you these slides 3 weeks ago, so we're not going to spend many seconds on PEMF. We want you to know that PEMF fits like a glove in my mind as a synergy with lasers and with the electrical therapies you're going to learn from Greg Westphal today. And when you begin to see that it all makes sense to you, because we know that when you're really sick in this country, we'll put you ideally in a hyperbaric chamber. I can get much of that increase in oxygen by treating part of your body or your whole body. If it's me, I treat my foot and my back and my lung and my liver. So I treat everything because I know that I'm restoring the membrane potential. That doesn't mean much to you. Big word, cell membrane potential. Think of it this way. When your car won't start, you need the electrical potential restored to your battery, so you hook it up to something. That is what Greg Westphal will be teaching you about today with the unique high Tesla, low amperage, high voltage approach to restoring membrane potential. In addition to that, there's all these other things that with PEMF, the molecules tend to line up. The pH becomes alkaline, which means that early cancers that we all carry find it hard to grow. And when you're alkaline, you release oxygen into tissues, and you get the blood back to the thickness of wine instead of thick blood like ketchup, which is what makes people unable to think and leads to fatal blood clots. So as you begin to look at what we showed you a couple weeks ago, we do know for years it's been proven that you can heal broken bones in a third of the normal amount of time, which is why no matter what is wrong with anyone, if you would use my FIGHT program to understand the detox and the nutritional support, and then maybe find a doctor that has a PEMF device. They cost the doctor $20,000. He'll have to charge you for a treatment. But if you do that, and then with Greg's help, and next week Mike will help explain, as his partner, how we can get this in your home if you need to rent it or even buy it, and learn additional things you can do that will bring the physics back into optimal range for those of us who appreciate how all this fits and understand that we're living on Earth at a time that oxygen levels have been going away. Now we have proof that magnetic levels are dropping, so we can make all of these things more understandable. So it's important. The electromagnetic pulses that we do with the PEMF is giving microcurrents, and the microcurrents are something that we can generate for you when you have a hip that won't work or an aunt that has got a stroke. We can use these devices and exercise a part of her body in a way that is not done by any of the physical therapists available in the country unless they own this equipment and take the time to learn this simple approach that can add 10 inches of real muscle to a leg that's paralyzed. Now, they can't do that without understanding resistance exercise training, and that can't be done without having access to this unique True Tesla-based therapy. Now, it's nice for you to know that the PEMF that I told you about 3 weeks ago is called NeuroStar when you get the one that is approved and is being used at Stanford and UCLA, and it's safe and it's effective and it's known to stimulate the brain, and that device only allows you to treat just the brain. And they sell for $60,000, and so it's a little pricey to get what they recommend. They want you to get 24 to 30 treatments, but why is it taking that long? Because I am convinced from all my reading and the research, it's turning on stem cells, which is why I tell everybody I have a new back. And so this is what the $60,000 device looks like. Clearly, it was not designed to help you treat your liver and get the toxins out of your liver, or to help you walk again on an ankle that has prevented you from walking. But you're going to learn today from Greg of additional ways to do this that we can do at home, so not everybody has to chase these particular devices that I'm describing. So there are scientific publications and presentations that tell you about transcranial magnetic stimulation, and this is a little look at this, and it is important to you know that we understand that this pulsed electromagnetic field is working through stem cell production. And you will find that it's very nice to know that bone marrow stem cells start to proliferate in one of their phases, dramatically increased, which is why I am so convinced that at age 76, I'll be a lot younger next year, because I'll be on my PEMF and the beautiful therapies that Greg will tell you about in a few moments. But it needs to know that when you use PEMF, you can rewire the brain and handle the abnormal brain physiology, the electrophysiology. In all these people with disabling headaches or insomnia, we're treating them with PEMF. And if you can't get access to that, you're going to learn a lot that we can do alone with what Greg will tell you about. And then, if needed, we will have you find the centers of excellence that will add to their clinic one of the PEMFs so that you get the ultimate. Because we don't need Alzheimer's. Alzheimer's, technically, Dr. Whitehouse wrote the book, The Myth of Alzheimer's. It doesn't exist, folks. It was invented to get money from Congress. When you understand that Alzheimer's is no different than Parkinson's, which is no different than MS, which is all part of ADHD and ADD and autism and Lyme and all the diseases that I teach you how to treat from cancer to aging, when you use my FIGHT program and add these wonderful things like PEMF, pulsed electromagnetic field therapy. This is the device that the doctors are putting in their office today. This is the one that's changing my life. It comes in an office model and a portable model. And the electrotherapy that we're going to now hear from Greg, if you look at Wikipedia, this idea, the father of electrotherapy, goes back to 1855. And you can use electricity not just for such things as improving blood circulation and muscle re-education and relaxing muscle spasm and improving range of motion and preventing disuse atrophy and preventing clots immediately after surgery. Those are approved uses the FDA allows for the devices you'll be hearing about. But there are other off-label uses, as I taught some 1,200 doctors to treat some 12 million people over the years using chelation therapy, which was only approved to get the lead out, and we found it had additional uses. So when you're hearing today from Greg, as he starts to talk, these are some of the things I will point out to you that have been widely researched that may not yet have legal thing that we can talk about. For FDA viewpoint, they have those limited that I've just rattled off, but there are so many things, and when you combine it with what we'll cover in 2 weeks, which is a nice, simple thing of a pad you sleep on, and why magnets work and how they can do, and how lasers are going to work much better in a magnetic field, as will electricity, because of quantum mechanics. So lasers will treat all of these kinds of conditions, and the principles of quantum physics, which is another word for quantum mechanics, lets you understand how there are biophotons, and simply taking a pocket laser that we use from Office Max and holding it over a tooth in a magnetic field, I can cancel most people needing to have otherwise a root canal, because this is the future, folks. It is the physics that we're bringing back to physician, and we're going to put the ATP, we're going to put the power in the powerhouse of every cell. Your heart cells, if you've been exercising like I do on my bike, you may have 1,000 of these little generators in every muscle cell of your heart. And I'll be putting on a workshop, and these speakers, including our guest now, Greg Westphal, Vice President of NeuroCare, will be one of the speakers, as well with Dr. Pollack from Johns Hopkins, Dr. Bondley, head of the North American Magnetic Research Society. All of these will be attending my energy medicine workshop starting March 3 through 7. We hope some or many of you will come. We'll have a free Sunday afternoon from noon to 7 that anyone can attend. It's being held at the beautiful Buttes in conjunction with my organization, the Arizona Homeopathic Integrative Medical Association. And all of you, I'm reminding you that it's free for all health professionals to have your questions answered about how to treat MS and autism and breast cancer by going to my website and joining FACT. It's open to any healthcare professional, and I have a whole website just on zeolite, fighting for your health, and I'm turning this over now to Greg Westphal, who's going to take over the rest of this presentation today.
Well, Dr. Gordon, thanks so much. It's an honor to be here today on this webinar, and I have so much to share with you, but I want to keep it very concise. I do want to say you yourself have a very magnetic personality. In fact, all of us do. We don't realize we live. I can't get away from you. You know, I see you on national infomercials. I was traveling nationwide in 2 major cities, and I heard you on a nationwide talk show. And then I picked up a book the other day on the aspirin alternative on enzymes, and there you are on the back of that book. So it truly is an honor to be here. That book happens to be sitting on top of one called Ultra Prevention by Mark Hyman and Mark Leponis, in which they talk about the fact that the body produces 2/3 of its weight every day in ATP. Did you know that? Quite remarkable.
No, that's amazing.
They call the ATP the gasoline the cells run on. They produce it, the mitochondria in the cells produce it out of the fuel oil they get in glucose that is supposed to be delivered to the cells in a properly functioning system. We find that that requires blood to move at a certain velocity in order to be able to deliver the glucose and the oxygen through the tiny 5-micron capillaries. Unfortunately, when people age and they get disuse atrophy and they get edema built up, if you don't use it, you lose it. But one of the ways we get it, with 24 million diabetics in this country alone, 1 in 4 don't know they have it, is the fluid buildup increases the post-capillary pressure to the point that it slows the velocity of the blood on the arterial side, so that the 7-micron blood cells can't elongate down to 3 or 4 microns to fit through the tiny 5-micron capillaries and deliver their payload. So consequently, the blood cells, after delivering the payload, they're not able to pick up the acids and the carbon dioxide from the cells and then move over to the venous side and dump it off in the kidneys and go to lungs and breathe out the carbon dioxide, and Al Gore makes money. Gary, every one of our cells has a photoreceptor on it that responds to the ATP pump and increases the production of ATP. You'll be interested to note one study I was reading recently estimated that the human, each cubic meter of the human body has 15 million volts of electricity. We truly are electrical beings living in a giant magnet, and these charges get out of whack and out of balance, and they can be rebalanced and recalibrated by certain things that we do. I was intrigued to hear you talk about the barefoot on the street. But one of the things I'm going to focus on is just some very pure play information about things like diabetic neuropathy and incontinence and range of motion issues without surgery. One of the studies I'm going to refer to in today's presentation is a study with 87 patients scheduled for amputation because of diabetic and circulatory neuropathy in Mexico. 100% of those patients had their limbs saved from amputation. We're including dry gangrene. You could run cloths through some of these feet. It was quite monstrous, the problem that some of these people had, and the results were absolutely staggering. In fact, it made us look kind of bad, Gary, because we had 100% of the patients scheduled for amputation have their amputations canceled. The wounds were just horrific in some of these patients, and the progress over time was quite remarkable. You can see the body can heal itself if you're able to move out the edema and increase local circulation. And one of the things I want to cover in my presentation today is the fact that I want to stay within the parameters that the FDA has given us for the claims that we make as a company. We don't need to go outside of these parameters, Gary, to affect a wide range of maladies. It's amazing how the body can heal itself. There's someone was reading me a scripture the other day that said the life of the body is the blood thereof. And it makes sense that if the blood can't get to a certain part of the body, there's a new study on glucosamine talking about how if it's taken without exercise, it can actually damage the pancreas cells and increase blood sugar, increasing the viscosity of the blood. And part of that whole genesis of heart disease talked about by the blood thinner cure boys, the origin of atherosclerosis, Kinsey and Turkington, the blood thinner cure. Quite interesting. How we stay within these parameters as we make our claims about the device I'm going to share with you today. None of us make any claims outside of those allowed by the FDA with our 510K, which we obtained in 1993. Increased local blood circulation is how we move out edema. Neuromuscular re-education, actually relaxing muscles in spasm and correcting muscle strength imbalances, maintaining or increasing range of motion, prevention or retardation of tissues atrophy. We've actually increased the girth of thighs of stroke patients by 10 inches over an 8-week course of therapy. There's still contractibility to patients with paralysis, contractibility to the lymphatic vessels, arterial vessels, and venous vessels, and 83% of total paralysis patients, whether quadriplegic or paraplegic, still have the spinal cord intact. It's choked. The functioning is choked off by fluid buildup, inflammation, edema, bruising, and many of these patients see a return of function. We've had actually miraculous results with patients being able to either return function or reduce spasticity and increase the meat that they have to sit on. One other application for this instrument I'm about to talk to you about is immediate post-surgical stimulation of calf muscles to prevent venous thrombosis, and it can go home with the patients. This device is so safe, it's cleared by the FDA to go home with patients. The father of electrotherapy announced that alternating current was superior to direct current for electrotherapeutic triggering of muscle contractions. In 1998, Medicare was going to stop reimbursing for electrostim. There had been 50 years of the technology available, 1,200 manufacturers, and you had all kinds of claims being made about the technology, that it was a frequency or the magic wave shape and that did it, and it was just confusing to CMS. The attorney for the lobby for the Physical Therapy Association that was collecting for this procedure contacted the founder of NeuroCare and asked him to review all of the articles and try to save the reimbursement. Tom Oliver highlighted the one commonality in over 250 studies. They sent it into CMS, and the folks at CMS said, well, why didn't someone point this out to us in the past? The one commonality that makes electrostim effective is muscle contractions, and that comes from voltage. The discomfort and problems with the compliance comes from amperage. The higher the amperage, the more the discomfort, the more the warming effect on the skin, if you will. I'll come back to that in a minute. I'm just going to talk to you about some of the applications that we find that are huge. Incontinence is a $12 billion a year business. Diabetic and circulatory neuropathy is about $87 billion a year business. Wound healing. We really aren't treating pain or wounds. What we're doing is treating the conditions that cause the pain and making those conditions go away, dealing with the cause, whether it's muscle strength imbalances, ergonomic repetitive motion problems. And almost every chiropractor we find is adjusting from one side of the bed. We can hook a couple electrodes up on them and do impedance comparisons from side to side with a bilateral paired stimuli diagnosis. And you would be amazed how often we can quantify muscle strength imbalances from side to side. We find this often in patients as they have the compensation going up the spine. And so we do the same thing with wounds. We're not treating the wounds, we're treating the condition that's preventing the wound from healing, moving out the edema, increasing local circulation, and allowing the blood cells to deliver the payload through those tiny capillaries. Once the blood can return to high velocity and the blood cells can elongate, deliver their payload, and then go back over to the venous side and dump off the waste products. Moving out edema, retarding, reversing disuse atrophy, relaxing muscles and spasm is fundamental to getting to the core cause of these imbalances. Often we find patients who've had adjustments for years, had their spine manipulated as if it floats in a vacuum, when in fact it's held in place by the soft tissue issues. So if you're not addressing the soft tissue issues, the muscles in spasm, complaining because they're carrying the weight of the other side, you're just hacking at the leaves of the problems. We got our 510K, as we said, in 1993. We have over 4,000 units in use and a proven proprietary protocol based on monitoring over 1 million treatments to perfect what works and what doesn't work. Yet, we like to say that we have a long fuse in this regard, yet a big bang of a revolution today, because only recently have we opened up a Center of Excellence strategy, partnering with medical practices in each key marketplace to offer the stellar results and unique selling proposition and unique combination of services for medical practices where they can actually send patients home with the equipment in a true partnership with the provider, so patients can do the heavy lifting at home and get the equivalent of a deep physical therapy treatment that can actually do much more than many of the passive movement of the limbs that PTs do bilaterally. Patients can do this in the privacy of their own home with the world's only true Tesla high voltage, low amperage, AC output neuromuscular electrical stimulator. This is registered with the FDA for the claims that I documented before. This is not to be confused with all other neuromuscular electrical stimulators or TENS units. If you had a fork in your hand and a TENS unit was placed on your forearm, it would block the signals of pain to your brain. NeuroCare is more like taking the fork out of the hand, removing the cause of the pain. It's a very elegantly simple system that's safe, can go home with the patients, and is based on Tesla's invention of AC versus DC. All other neuromuscular electrical stimulators are DC output, 125 volts at 90 milliamps. Back when Tesla was competing with Edison, he gave up all of his patents to Westinghouse, including the one on fluorescent lights, but well, I can't. I'm having a brain attack here. If someone can think of it, let me know. It's the lights that light up at night. You see them all over Vegas. Tesla actually had 300 patents, and he gave them all to Westinghouse to win the transmission wars. The first placed a generation station at Niagara Falls and transmitted the power through small cables to the World's Fair in Buffalo, New York, and was able to overcome the resistance of distance using AC output. We have the same kind of resistance in the human body, which causes discomfort and limits compliance, so that patients can only tolerate about 30 volts at 10 milliamps with DC output. The electricity, if I hook up, Dr. Gordon saw me hook up a bodybuilder with just a fantastic body. I hooked up his triceps, and with all of his strength, he wasn't able to bend his arm. We have videos of that available at renuamedical.com. That's RENUA medical.com, and you can watch some of the testimonial videos of patients and the results they've been able to obtain by tolerating long, heavy-duty, deep muscle contractions for long periods of time. We're able to move out edema and saturate the working muscles so that the active muscle fibers get saturated, and the high voltage will then leap over to the inactive fibers and actually exhaust them to the point where the body will recruit new muscle fibers and actually increase the growth of the muscles. Very low amps are required to tolerate this high voltage. We go up to, unlike other systems that most patients can only tolerate in DC, about 30 volts at 10 milliamps. We go up to 440 volts at just a tiny 4.4 milliamps, improving compliance, giving much deeper contractions, moving out the edema, which is why we're able to save limbs from amputation when other systems are not. Something is better than nothing, but having greater tolerance for longer treatments more frequently in the privacy of their own home with a system that cannot burn a neuropathy patient gives us safety that has been documented in the Pressure Ulcer Treatment Guide number 15 by the United States Department of Health and Human Services. The Public Health Service, in conjunction with the report from the Agency for Healthcare Policy and Research, studied with this panel of experts all the detailed science-based methodology behind peer review and pilot review of all kinds of different technology, including electrotherapy, hyperbaric oxygen, infrared, ultraviolet, low-energy laser radiation, ultrasound, miscellaneous topical agents, et cetera, et cetera. In this report, they said at this time, electrotherapy is the only adjunctive therapy with sufficient supporting evidence to warrant recommendation by the panel. I will say that they did not give a high enough dosage on the low-level laser therapy. So they could, it was like needing 1,000 milligrams. They only gave like 100 milligrams. In this case, it was joules, watts of photobiostimulation per centimeter squared. They did not have a high enough dosage to complement what we were able to achieve with electrotherapy. But it is interesting to note that the government, this esteemed Agency for Healthcare Policy and Research, has determined that electrotherapy works, and this is one of the ways we were able to save the reimbursement for electrotherapy. Keep in mind the common key to the efficacy of electrotherapy is muscle contractions. We're talking about neuromuscular electrical stimulators. The true Tesla difference is a muscle in spasm, of course, is involuntarily contracted, shortened, just like a tightened string pulling on a bow. So being able to relax that muscle in spasm can get to the core condition of and relieve pain, and then we can find the muscle strength imbalances and strengthen one side ipsilaterally of the low back, for example, and correct the muscle strength imbalance that caused the muscle to go in contraction in the first place. So the true Tesla difference is the patient can tolerate much longer treatments more frequently. Some of the patients scheduled for amputation whose limbs we've been able to save from amputation actually were on diuretics, and it evaporated all the fluid in their feet, leaving just this honey-like sludge in their feet that took a very high voltage. Keep in mind the fluid buildup is a better conductor than the muscles, so we first get very little contractions with patients with a lot of edema. with diabetic neuropathy. We get a lot of resistance with DC output. You can't get to the deep pelvic floor muscles with incontinence to reverse atrophy and increase their girth. So you need the AC output, so you're not limited by the 125 volts and 90 milliamps of a DC output system. Again, most patients can only tolerate 30 volts at 10 milliamps, and I can fry an egg with my microwave oven at 60 milliamps. In fact, these are burns on my arm caused by a DC output neuromuscular electrical stimulator that sold for $32,800. Couldn't go home with the patients. Very popular system. Patients that don't have that have neuropathy actually can't feel when you're cooking their feet like this, and a wound like that might not heal because they don't have the perfusion to heal. Only NeuroCare safely outputs 440 volts at just over 4 milliamps in AC output for maximum effect and comfort. Years ago, some companies launched a Russian stem that gave a little higher voltage, up to about 60 volts at about 10 milliamps, and they got more love and more results for the patients. Again, they couldn't go home with the patients, but they were nothing like what we're able to do with 14 times the voltage that patients can tolerate at 1/20th the amperage, with a very elegantly simple system that can go home with patients so they can treat themselves in the privacy of their home, in addition to the in-office treatments and diagnostic peristimuli diagnosis, comparing the side with the edema and the fluid buildup to the side without it. If we can't burn the patients, we can't injure the patients. In fact, some of our videos of weightlifters who can curl 160 pounds, Dr. Gordon witnesses himself, they were laughing and giggling and saying it felt good when we had so much electricity going through, voltage going through their triceps. With all the strength of their antagonistic muscle group, the biceps, they weren't able to bend their arm, yet it didn't burn them. So they call it full resistance exercise for a reason. And when diabetic patients, Dr. Gordon, get full resistance exercise, there are tons of medical journal articles that talk about the ability of a body to normalize the blood sugar when patients can get full resistance exercise. In fact, a few weeks ago, one of the top doctors with one of the religious-based healthcare delivery systems in the United States, very large, put a patient who was scheduled for an insulin pump implant on NeuroCare. She couldn't exercise, she couldn't tolerate the exercise, but a week of NeuroCare's full resistance exercise normalized her body, was able to normalize the blood sugars by moving out the edema, increasing the velocity of the arterial blood supply, and dropping, by allowing the velocity to increase, the blood cells could elongate, fit through the tiny capillaries, deliver the payload, and thereby the blood sugars normalized because they weren't getting shunted over, the blood cells weren't getting shunted over to the venous side with all the payload still intact. So it's quite exciting what we're able to do for diabetic neuropathy patients, saving feet from amputation, and taking care of patients with foot pain. Recently, this past week, we videotaped several patients with the doctors in the room. In 15 minutes, their purple feet with deep tinting turned normal color, and the doctors are amazed, and they're saying this right on video. If you'd like to see copies of these videos, you can go to renuamedical.com, look at testimonials, or send an email to me, gwestfall@mail.com. That's GWESTFALL @mail.com. Or send a request for more information to CCC, that's Charlie, @renuamedical.com. And we'll repeat that information later. What we have here is an elegantly simple system, and the beauty of this program is we have no credit turndowns for our doctors. We have no credit turndowns for patients. We have programs that can allow patients to be treated in office with a full Medicare reimbursable coverage program, or a concierge medicine cash program for people to be treated in the privacy of their home so they can partner with the doctors, give themselves a couple heavy-duty physical therapy treatments a day with deep muscle contractions with this instrument to truly partner with their healthcare provider and do the heavy lifting at home. With each treatment with a value of about $100, when patients can treat themselves twice a day, and some of these people scheduled for amputation have treated themselves 4 times a day to move out that honey-like sludge before they were able to return to normal activity and cancel their amputation. Frankly, each treatment if you treat yourself twice a day for a month, that's $6,000 in heavy-duty treatments when compared with the value of PT treatments, and over a 3-month course of therapy, $18,000 worth of heavy-duty PT treatments that people can treat themselves in their home. We have financing for our doctors to use in the privacy of their practice with a signature with just a 650 credit score. We can get the doctors the full protocol for all of their other core existing services, whatever other services might be nutrition consulting, or it might be other in-office PEMF treatments combined with acupuncture or manipulation of the spine, and other core treatments that might be stem cell treatments. We've had several stem cell experts agree with Dr. Gordon that the stem cells are pumped out of the bone marrow, and the weight-bearing exercise that we're able to induce, besides being the key therapy treatment for osteoporosis for many patients, again doing weight-bearing exercise. They're surmising that the acceleration of stem cells in the blood supply after receiving these treatments is backed up by some of the studies done at Creighton University by Mark Rendell, in which they documented the second wind effect of localized exercise with this device, actually having the same kind of second wind that major athletes experience when they go through the wall of exhaustion and they get their second wind. We've been able to document the vasodilation at certain intervals after the treatments because of the full resistance exercise that we're able to give patients who can't tolerate it themselves. They get exhausted walking out to the mailbox. Their feet hurt walking out to the mailbox. So we give patients positive results for clinics' worst patients. Many of our clinics are improving and increasing referrals from their peers because they are now getting results with these patients that are sent off to get a titanium shoulder put in, and after a week of treatment, they got patients doing push-ups. There's a place for surgery, but it's not the frontline place, and even the surgeons are finding if they offer a non-surgical solution, the patients will flock to them to try to avoid surgery, and the small percentage, maybe 15-20% of patients that we can't save from surgery, now they're doing a moral surgery, cutting on people that nothing else would help. Same thing can be offered to people with incontinence or TMJ. We find the genesis almost always with that being cervical edema that is chronic and built up and locked in, maybe from a 30-year-old auto accident. We're getting superior outcomes, which in today's new healthcare environment, outcomes are how you're measured, and the results that we get with most of these chronic problems are superior to anything I've seen in my 35-year career in the healthcare field. I was fortunate enough to set up the nation's largest base of installed bone densitometry systems in hospitals and major clinics with my business partner, Bob Corker, now Senator from Tennessee. And in the process of that, we developed special programs to make equipment available to doctors regardless of what their credit was, to provide them with turnkey marketing programs that can increase referrals from other physicians who don't know what to do with these problem patients. They don't know what to do. I've talked to OBGYNs who don't know what to do with an incontinent patient. They send them off for surgery, or they put them on drugs for the rest of their life. And these are ladies urinating 60 and 70 times a day, and it's a simple matter of the baby in the womb resting on the pelvic floor muscles the wrong way, atrophying, cutting off the blood supply so the pelvic floor muscles atrophy. A Kegel can't strengthen they can't even get to these muscles. They're non-existent. So they're exercising the vaginal wall muscles and the anus and doing nothing to get to the pelvic floor muscles, which have the job of holding the bladder in. You could be amazed at how quickly you could get 10 patients referred to you from one practice, because many of them refer out 5 or 10 a day for these type of procedures. In fact, I got to say that even though the American Physical Therapy Association endorses electrotherapy, and remember, the key to efficacy of electrotherapy is one thing: muscle contractions, moving out the edema, increasing local circulation, reversing muscle strength imbalances, correcting them, and giving the body the balance that it hungers for. In fact, almost every dentist that we hook up to our machine is in spasm on one side because they're reaching in the mouth for 20 years with one hand. They can't reach it with the right hand the opposite direction, just like dental hygienists. You would be amazed how many people we find with these same kind of muscle strength imbalances. Yet, often you could Google for lymphedema treatment, 68,000 Google references for lymphedema exercises, full resistance exercise, but these patients and their clinicians know they need full resistance exercise, but they can't get there. They can't do it. And what are they using in these treatment centers, often run by PTs? They're using a cuff, a big leg cuff that doesn't take advantage of the deep muscle contractions we're able to get with neural care. So these are just some list of the things endorsed by the American Physical Therapy Association. I wish more of their members would read what they endorse for the use of electrotherapy and the efficacy of electrotherapy. We have clinicians putting in $1,000 ads in the newspaper and generating $10,000 in clinic revenue every time they run the ad without insurance, with a cash program, with our patient therapy financing program, with no deposits from the patient and no payments for 30 days. Patients are able to sign up for the protocol they need to get $18,000 worth of physical therapy in their own home by using the equipment and partnering with their clinicians, and not just giving lip service to partnering, but actually doing a lot of the heavy lifting themselves. The clinicians are getting results with chronic problems, that patients that are scheduled for amputation. You would be amazed how many results we got with $200 TV ads in one clinic for incontinence. And Gary, we even got a few calls for incompetence. Boy, we'd really have something there if we had a cure for a fix for incompetence. We have a whole diagnostic program that can identify the pain signatures that are not dependent on patient truthfulness. They're not manipulatable by clinician or patients. If patients have that bad knee and range of motion problem, they're going to have signatures that document atrophied muscles, and a bilateral comparison with the healthy knee will show impedance differences. It takes more juice to transmit from the glass chalk up to the quads through the knee when you have a bunch of edema build up there, chronic edema from blowing out the knee a year ago. And atrophied muscles also take more juice to contract. So often we find one knee, it takes about 40 on our dial to get visible muscle contractions. The other knee with the problem takes 80 on the dial, to a lot more voltage, because most of the voltage is first going to the fluid, then the muscles, and then the nerves, in that order, the level of conductance. This allows us to provide the ultimate expert witness in any personal injury case. It happens to be the patient's own autonomic nervous system. It can't lie. It's not manipulatable. So there's a tremendous tool to document and quantify spasms, edema, atrophy, and then correct them with this instrument like nothing I've ever seen before. These patients are highly motivated because they're tired of urinating 60 and 70 times a day. They want to have a non-surgical, non-drug solution. They don't want to live the rest of their life on drugs or add a new drug to their cocktail of drugs they're already taking, which many experts surmise, including an article in JAMA about drug toxicity. We all know about the pain meds most of these patients have been on that are destroying the mucosal lining of the gut, increasing gut permeability. The GI journal called Gut had an article on colostrum's ability to prevent damage to the mucosal lining of the gut from NSAIDs and correct it. And there was another article in the American Journal of Clinical Nutrition about the same thing. And you can learn about not just the colostrum for gut health, but a liquid form of the active ingredients in colostrum, proline-rich polypeptides, taken sublingually for anti-inflammatory purposes, systemically, to get it into the bloodstream, and the role that plays with making people not so subject to allergies, asthma, a lot of the autoimmune problems that result from a systemically inflamed body that Dr. Chilton talks about in his magnificent book, Inflammation Nation. encourage you to read that. We have a program where the office keeps fees in office. We have several protocols that we'd be happy to send to you that would allow you to offer and participate with us with the unique Center of Excellence program and exclusive participation in our outreach and marketing and the results that we're able to obtain in certain levels. Co-managing these patients with other physicians in your local marketplace will allow you to claim your share in your marketplace of these multi-billion-dollar markets with a true result that gets results. In fact, our slogan as a company is expect results with the most common intractable chronic problems that others cannot fix. I think you'll be amazed at the solutions that we have to offer that can bring your practice a 3,000% per year return on investment with each instrument. We never turn down a practice. We have ways to provide funding for even practices that have had problems in the past and their patients. There's nothing more embarrassing than offering financing to a patient, only have them turned down because the financing source you're using only gives A-plus credit patients the financing. We think it's obscene to tell a patient you got to get your foot cut off because you don't, your lower socioeconomic level status doesn't provide you with the funds to save your foot. So we have protocols for, frankly, think about the bean counters telling people we can't afford to save everybody's feet. That guy goes on the public dole forever now. When we could have saved his foot, we got him a job where he's earning income that's taxable. It's a better program. Well, which would you want for your brother? 100% approved in-house financing available where we can invest in 1,000 systems around your office, having in-office management and guidance done in your office while they treat themselves at home, and they testify that, wow, Dr. Jones fixed me, and I have this whole protocol to do it. In fact, many of the rentals of the equipment will convert towards purchases, and there's love for our doctors in that scenario too. We have programs for even people with 480 credit scores, so we'd be happy to talk to you about. Again, send me an email to gwestfall, that's Gwestfall, at mail.com. That's not Gmail, that's mail.com. Or send a request to CCC, that's Charlie, at renuamedical.com. Go to that website, look at the video testimonials, pull down some of the white paper from that site, 27-page white paper, and learn how our financing program can also help you finance all of your other services and how we can use the same program to finance you in your practice and finance your other core existing services to complement everything that you do. I want to thank Dr. Gordon for giving me this forum to share with you. Doctor, I met an attorney in Las Vegas recently. He said to me, a lawyer with a briefcase can steal more than 1,000 men with guns. I thought that was a pretty amazing statement.
I am so pleased that you have shared your tremendous knowledge with all of the attendees on today's conference, and I hope all of you understand that what we're seeing here is that when we bring the physics back into the practice of medicine, I frankly have to tell you, many people who have been suffering with back pain, as you know, that's 1 out of 4 people in America have chronic back pain. Between the PEMF and the NeuroCare, I think that a lot of orthopedic and neurosurgeons would go hungry, because I assure you, the people being operated on are, at least in my estimation, minimum 8 out of 10 would cancel any surgery if they could experience a few treatments over a course of a month or 2 with the combination. And of course, for people who just get one, the NeuroCare itself is a standalone, giving people that powerful muscle contraction that is going to allow a muscle to normalize and go back into normal functioning. So I think that it is so sad, because we have everybody going in the health food store and they're picking up chondroitin and they're getting glucosamine, and as Greg has pointed out, these may not be safe if you're not even able to exercise. So across the board, this is exercise. I want that clear. When I give you PEMF, you will see visibly in front of your eyes, your arm is moving, your muscle of your abdomen is moving, every part, and you will be having things move that is more powerful than if you'd had 100 massages at one time. And you're getting a different kind of muscle contraction, and I think they are going to clearly be additive. And for those doctors who happen to already understand something about quantum mechanics, you'll get the idea that perhaps if we go back and decide what the universe is comprised of, if you look at the string theory, it moves you into harmonics. And if you move into harmonics, you'd be able to sit there and say, well, that's interesting. Maybe if I have this little bit of magnetic field, all of a sudden that laser will not go just believably to go a half an inch deep. The laser will have almost no friction and may go all the way through. So you're serving with that laser an electron like you do with the vitamin C that I preach about, because vitamin C, as Tom Levy eloquently wrote in his book Curing the Incurable, vitamin C is giving you electrons. And that's what we're doing with the electrical, and that's what we're doing with the PEMF, and that's what we're doing with laser. So I think you're getting the idea that I am seeing the doctor of the future will not only be a physician who practices integrative, alternative, comprehensive, complex, advanced, whatever you want to call it, but will be doing it with physics. And Greg, I thank you so much for your contribution today. And all of you, please understand, next week, Greg's associate, Mike Bianco from Renua Medical, will be on to discuss more of what you've learned today and how all of this becomes doable for the patient. Because I have patients who live in Timbuktu and they don't have a doctor within 100 miles. Yet Renua Medical will see to it that they actually understand, get the information, get the manual, get the device, and actually start treating themselves at home under a program in which it's guaranteed money back. So I'm kind of confident that we can start reaching patients who right now can't put it all together because they don't have a local center of excellence. But I think you can see that with the enthusiasm that Greg Westphal has brought to the story today, there'll be a lot more centers of excellence where you can send your loved ones with complex problems. And as you now understand from me, when you combine my FIGHT program with these new principles of physics, I don't think there's any condition that can't be greatly improved, and I thank you for your participation today. That will be the end of today's class. Thank you.
Thank you, Dr. Gordon, and thank you, Mr. Westphal. We encourage you to browse Dr. Gordon's website, which is www.gordonresearch.com, and Mr. Westphal's website is www.renuamedical.com. The products that Dr. Gordon has formulated are available through Longevity Plus. Please visit our website at www.longevityplus.com or call 800-580-7587 to place your order. We value all of you, and thank you for joining us.